A comprehensive analysis of abortion. Medically and legally speaking, the definition of an abortion can vary somewhat. Medically, an abortion includes any reason for the loss of a fetus, whether that be a miscarriage or a surgical removal of the embryo. Depending on where you are, legally an abortion is defined as the intentional termination of a pregnancy through various methods. Or, as you can see here, another definition of abortion is the termination of a pregnancy after, accompanied by, resulting in, or closely followed by the death of the embryo or fetus. One type of abortion is a medication abortion. This type of abortion involves taking a pill that will terminate the pregnancy at some point between conception and 8 weeks. A medication abortion can be done up to 9 and 10 weeks of the pregnancy. Another type of abortion is an in-clinic abortion. This type involves a clinician using various tools to remove the embryo and any remaining tissue from the uterus. An in-clinic abortion is effective 99% of the time. In the United States, abortion is legal and each state must have at least one clinic, although the states themselves are able to regulate most abortion policies. Based on a Supreme Court ruling, women may obtain an abortion through a physician during the first trimester. During the second trimester, the state may only intervene to protect the woman's health. And in the third trimester, the state may intervene to protect the life of the fetus, but not at the detriment of the mother. Although getting an abortion is an extremely personal decision, responses to that decision can come from the woman herself, her close friends and family, her local community, and various others as well. Social relations can play a large role in a woman's decision to obtain an abortion. When a woman decides to get an abortion, she does so for health concerns, emotional, ethical, or religious reasons. Other reasons for an abortion may include the effect a pregnancy may have on their relationships, on their education, or their career. The decision to obtain an abortion may also be influenced by familial opinions, religious beliefs, and societal opinions as well. A parent can be affected by a child's decision to obtain an abortion as well, whether that parent be concerned about their child's ability to care for the newborn, or the parent be upset that their child doesn't wish to carry the pregnancy to term. It can be extremely difficult for a woman considering an abortion if they are lacking a support system. Studies have found that hostility surrounding their decision to obtain an abortion can contribute to negative feelings far after the abortion itself. Other than the woman herself and family, a partner can play a large role in this decision as well. It's best for the woman if the partner is part of the decision and supportive of it. Community responses to abortion can include newspaper articles, rallies, harsh language, and public comments. There are anti-abortion groups whose aim is to push their political propaganda on women who are searching for these services. There have been doctors whose lives were threatened and clinics that have been blown up with explosives. Depending on where an individual lives, the community response to abortion can be almost deadly. Social influence also plays a large role in an individual's decision to obtain an abortion. For example, a woman who was raised in a strictly religious family may never consider an abortion, while a woman who was exposed to different ideas about conception and birth may be more open to the idea of an abortion if the need ever did arise. Another aspect of this would be the individual's community. In very conservative communities, it can be widely known how people perceive different acts, particularly those that they consider to be related to morality. This can largely influence a woman's decision to obtain an abortion. Reciprocal determinism implies that behavior is influenced by personal factors as well as the environment. Humans are not entirely free agents, but they are neither strictly controlled and at the mercy of their environment. The concept of reciprocal determinism applies to abortion in that a woman's beliefs, geographic location, local laws, friends, and family support will all play a role in her decision to get an abortion or to carry a pregnancy to term. Abortion can be a widely controversial topic. There are groups who spend their time pushing anti-abortion propaganda on women who are considering it as an option. In certain areas, it can be difficult to obtain reliable information about the procedure, timelines, recovery, possible repercussions of the pill or an in-clinic procedure. The local community, as well as availability and access to a safe clinic, are also environmental factors that affect a woman's decision. Women who have a good support system oftentimes fare slightly better than those without. Women who are religious may experience feelings of guilt if obtaining an abortion is against their beliefs, but still the right decision for them. Many of these factors are also dependent on whether or not the woman decides to share her decision with others or keep it to herself. While this personal decision can alleviate some societal recourse that may come from obtaining an abortion, it can also be difficult for some women following the abortion procedure, and having support at that time can be very beneficial. All of these factors, and even more than I have come up with, will affect a woman's decision about whether or not an abortion is right for her. In the past, many abortions had to be done in secret. Because of this, a lot of them have been, and some still are, unreported. This has made it difficult to measure statistics and various risks associated for women who are forced to obtain these secret abortions. Although research is still gathered from self-report surveys and clinical offices that conduct abortions, other research can be gathered from reports of abortion-related morbidity and abortion-related mortality. Various polls are also sent out through communities measuring acceptance of abortion as well as thoughts and feelings on abortion. Clinical research has been done to determine the safety and effectiveness of the procedure as well. Social psychology has and continues obtaining and bringing forth research regarding abortion and societal implications. Through social psychology, we are able to determine societal opinions. We can determine the impact of having accessible clinics in various communities, and the impact that misinformation and a lack of resources can have on women and communities later down the road. Social psychology can also help assess the impact on children that are raised by mothers who had wanted an abortion but were unable to obtain one due to various reasons. The public health sector can contribute massively in addressing current abortion policies and practices. The Center for Disease Control and Prevention created 10 public health services in relation to abortion. These public health services include monitoring the health status of the community to identify health problems, diagnosing and investigating health problems and hazards in the community, mobilizing community partnerships to identify and solve health problems, develop policies and plans that support individual and community health efforts, enforce laws and regulations that protect health and assure safety, link people to needed personal health services and ensure provisions of health care when otherwise unavailable, assure a competent public health and personal health care workforce, evaluate effectiveness, accessibility, and quality of personal and population-based health services, conduct research to attain new insight and innovative solutions to health problems, and inform, educate, and empower people about health issues, all in relation to abortion. Employing doctors, nurses, counselors, and any other health professional alike to be sharing accurate and informative information in relation to abortion can help alleviate a lot of confusion that surrounds abortion. Providing women with access to credible resources and safe facilities is another way that the health sector can improve various issues associated with abortions currently. Another discipline that could deeply affect abortion policies and practices is lawmakers and policymakers. Many misconceptions or beliefs surrounding the practices can be eradicated simply by making decisions and policies based solely on facts and scientific research. Although there may or may not be backlash from those who have a different opinion, enacting policy based on science is a safe and effective way to ensure that the public is being taken care of and has access to the resources that they need.